Doing IV push and piggyback today. I'll be giving 80 milligrams of gentamicin IV piggyback, and then I will be doing 0.25 milligrams of digoxin, which would be 1 milliliter. First, I'm going to check my doctor's orders against my MAR. I'm going to look for the right time, right route, right amount, right medication, right patient, and safety. Okay, now I'm going to go ahead and get all my stuff together. Okay, and I'm going to wash my hands. Okay, I've already got my math problems worked out. I'll be giving gentamicin 25 drops a minute, and digoxin I'll be giving 1 milliliter over 5 minutes, or 0.2 milliliters every 1 minute. Okay, so right now I'm looking at my digoxin. It is a safe dose. I'll be looking for road administration. That is over 5 minutes. Let's see, I'll be looking at all the precautions and look for my drug and lab interactions. I need to monitor my serum levels and the pulse. I need to make sure it's at least 60 or greater before I give it. Now with gentamicin, okay, it's a safe dose. It will be diluted in 5% dextrose, and that is compatible. And I'll be looking for my rate administration, and we'll be giving it over 60 minutes. Let's see, and then we'll be looking for our precautions. We need to take extreme precaution whenever they're taking it for over 7 to 10 days, especially the elderly, patients with kidney disease or heart problems. It can cause C. diff, so we need to make sure we monitor for that. And side effects like anorexia, burning, dizziness, fever, headache, and let the patient know that that's signs that they need to be checking out for, and let me know if they do have any of those side effects. Okay, so now that I have all this correct, I've already checked everything. Check the allergies. They don't have any allergies for this. Let's see, and then I'm gonna go ahead and get all my stuff prepared before I go into the room. Okay, I've already washed my hands. I'll be getting my IV push ready first. Okay, and since it's Cinnaval, I'll be using a filtered needle. Got it at 1 milliliter. Okay, and then I'm going to go ahead and label it. patient's name, the drug, digoxin, and then it's got 1 milliliter. Today's date, and it's 2/4/19, and the time, and my name as well, since I prepared it. Okay, now I've got that prepared. Next, I'm gonna go ahead and get my piggyback primed. Okay, I'm gonna go ahead and clamp it. Okay. Okay, I'm just going to maintain sterility. Okay. Alright, I'm just going to hang this here for a minute. I'm going to unclamp the first one. Then I'm going to slowly unclamp this and prime it. Okay, now it's primed and it's ready to go. Now, as I have this done, I'm going to go ahead and write the drug, it's gentamicin, the date and the time and the expiration date and the patient's name and the start time and the start date. And I will also write the amount of gentamicin that is in this 100 milliliters of dextrose. Okay, and now we're ready to go into the patient's room. Alright, I've got everything that I need. Okay, and then I'm ready to go in. Next, when I go into the patient's room, I'm going to wash my hands as I'm going in. I'm going to ask the patient to give me his name and date of birth. I'm going to ask for allergies once again. I'm going to go ahead and explain to him what I'm doing. I'm giving him digoxin and I'm giving him gentamicin. And I will then explain to him about the signs and symptoms that I went over earlier and tell him that if he sees any of those severe reactions to go ahead and call me. And that way we don't have any severe reactions. Okay, now I'm going to check for IV patency. I'm going to lower it. And I do have blood return, flash back. Okay. Alright, so now that my IV is patent, alright, I'm going to go ahead and do my IV push. Alright. And clean this off. And clean this off as well. Okay. Okay, I'm going to be giving this 1 milliliter over 5 minutes using the push-pause method. I'll be giving 0.2 milliliters every minute. Alright. And while I'm doing this, I'll be checking my watch also. so I've given it over the full 5 minutes. I'm checking for signs of inflammation, infection, redness, swelling, or any of those signs and symptoms. I'm checking on my patient. He is fine, and now I will be going ahead and hanging the ivpb bag. Alright, I'm going to go ahead and wash my hands again. Now, I'm going to go ahead, clamp everything off. I'm going to go ahead and lower my primary. Okay, and I'm going to go ahead and put my IV piggyback higher. Okay. Okay, now. Go ahead and clean that just to make sure. And this. Okay. Okay. Alright, now I can unclamp this, because I will be controlling my piggyback by my secondary, by my primary. Alright, now we have everything unclamped. Alright, we'll be doing 25 drops a minute, and that will equal out to about 6 drops every 15 seconds. Alright, now we're going to time it. Okay, and then I'm going to be checking it for the full minute. Okay, and now that it's set, I'm going to go ahead and let it run. And while it's doing that, I'll be go ahead and check that IV site once again, make sure there's no swelling or anything. There is none. Alright, so now we're going to say that the IV is through. We're going to stop the secondary. Like this. Okay. Go ahead and take this down. Get the primary back up. And we're going to go ahead and start the primary back to its original set that it was before we hung the piggyback. We'll go ahead and check that. Okay, it's set. Alright, and now I'm going to make sure the patient is safe, comfortable, bed low, side rails up ×2, call bell in place, and then I'm going to go ahead and document what I gave today and what time I gave it and everything else. Alright, thank you.